now it's late.
You don't need to worry about. So a little bit late, but we can fix it. 진작에 하셨어야 되는데
맞아요.
많이 안 좋으세요.
호주에서 코를 가리고 갔는데 하는 의사가 많이 없고 그래서 치료가 잘 안 된 것 같습니다.
지금 이것 때문에 들어오신 거예요?
네, 일부러 언니 하고 와서 식사하는 걸 보고 자기도 할 생각을 하고
알겠습니다. This time solve the problem and place the implant. But this time we cannot finish the restoration. You have to come back one more time.
Yes,
Maybe around 6 months later, and then you stay around 1 month. You can finish all the restoration. This is bone level. I draw the line. It's a normal bone level, and this is your state. It means your bone is resolved. So this kind of tooth, you can feel movable, right? You cannot bite food. You must feel some pain. So your first problem is a periodontitis. When you are toothbrushing, you always feel some bleeding and gum swelling. This is a kind of periodontitis symptom. So we also have to treat your gum disease, and then also we'll install implantation this time. This is a first molar, but you lost maybe more than 5 years.
Yeah.
So this tooth is a little bit
Under tilting.
tilted. We cannot make it the crown. So wisdom tooth is usually posterior area we need a 2 implant. And then we make a normal like this way. Also this one, we will make a crown like this way. And the upper area, most of patient after the lost tooth, the bone is decreased. And this area, the bone is around 3 millimeter. Not so much bone. So we need a bone grafting. But we will do the same time. Implant placement and the bone graft together.
Okay.
It's a one-time surgery. And you lost the 3 teeth, but we just place a 2 implant. And then we'll make a 3 crown. We call this is implant bridge. If you want to, I can place 1 more implant, but it's not necessary. 2 implant is enough. And just have to remove. And then I will place 3 implant and make a 4 crown. You don't have enough time, so I will not wait. And surgery day, I will extract your tooth, and then at the same day, I press the implant. And then the rest one about the anterior area. Do you feel any discomfort here and here?
When I'm eating apple, that's the teeth, that's the gum. And if the apple comes and hits the gum, because in Australia a long time ago I went with the gum specialist to clean it. It was maybe 8 years ago.
Yeah, it's too long time ago.
Yeah, and that's why I called it too, and discreasing, and that's what stopped. The gum discreasing stopped there because they cleaned it and so on. But also because of brushing too much, used to bleed a little bit, but now stopped bleeding.
There's a serious gum inflammation here and here. And also your bone level is not so good. This tooth cannot stay long. Also this tooth also not good. Aesthetic is not so beautiful. You know, gum is too decreased and your tooth a little bit spacing here. It's not so beautiful.
Yes.
If you want to, I can fix it. How about your anterior tooth? You want to solve it or not?
The gap, because most important is for me to able to eat too.
This for example, this is a spacing and gum swelling, also severe gum recession. And we place a 2 implant and make a 4 crown, can be more better.
Okay.
So if you treat the anterior tooth, we make a temporary light directory.
But the one that you remove and
After extraction, we'll place implant. There's no tooth at all, right? But we take impression and make a temporary crown immediately. Yeah. But posterior area, we cannot make it. Posterior area, so it takes a time. If you make a crown, it can be failed. But anterior area, there's not so much pores, so we can make a temporary crown. But posterior area, if you make a temporary crown, the pores can be delivered and then implant may be failed. So we cannot make a temporary crown in posterior area, but anterior area, not so much pores, so we can make a temporary crown. Okay? You don't need to worry about the social life.
I'm not worried. I'm just a village man. I don't worry about it. And I'm not that famous either.
저희 언니도 너무 잘 해주셔서 믿음이 가고
알겠습니다. 네.
짧게 좀 끝날 수 있어요.
이거는 이제 시간이 필요합니다. 특히 위에 뼈가 별로 없어서 최소 4개월에서 6개월 사이인데 이건 제가 수술하고 나서 말씀드릴 거예요. 정확한 거. Lower area, we need around only 2 months. But upper area, I said you don't have so much bone. So we need the grafting. It takes more time. And I can't tell you after the surgery. You don't need to worry about it. 저희도 더 신경 쓰입니다. 선체 실수도 용납이 안 되거든요.
임플란트 하고 나서 사과먹으면서 굉장히 행복해하는 사진을 보내왔었어요. 그거 보고 저희 식구들이 너무나 뿌듯했어요.
아이고 감사합니다.
사과 먹으면서 좋아했어요. 저희 가족이 다 여기를 오셨습니다. 너무 좋은 친구예요. 저희가 알아서 좋습니다. 그냥 만나는 사람 다 선전하고
But anterior area, for a better result, I have to remove 3 teeth. And then we need 2 implantation. restoration, and two teeth should be extracted, and lower area only one implant is enough. Press one implant and make a two crown. Upper area we need a two implant and like a three crown for each. It will be more beautiful. You don't need to worry about after the implantation. You can eat apple. And then also gum will be more natural and beautiful. Surgery time will be around 1 hour. After the surgery, we take impression, and the day after surgery, we'll make a temporary crown. After temporary restoration, a little bit afraid, temporary restoration is not so strong. Can be broken. So we recommend the
Soft food.
yeah, bread and pasta, noodle, soup is okay. Apple, no.